Hello, everyone. Thank you for taking the time to listen to this recorded webinar. My name is Brian Riley. I'm the Vice President at Centric Benefits Consulting, and I am here today to talk about Express Stores open enrollment for August 1st, 2017. I've only got about 15 minutes, so I'm going to talk faster than I normally would, but I would like to cover everything I can and, of course, show you how to find additional information about your benefits. So I'll jump right into it. For those of you who are familiar with it, the Minimal Essential Coverage Plan, the MEC plan, that is staying with MagnaCare. That is going to continue with MagnaCare. For all other insurance policies, they will all move to Cigna effective August 1st, 2017. The deadline to submit your coverage election through Balance Point is July 26th. 2017. No need to wait though. The sooner we get all the paperwork in, the sooner we can get ID cards in your hand. So I mentioned other resources that you can find information about your benefits. The website is mybenefitscount.com, username mybenefits at expressstores.com, password ABC123. Now that password is case sensitive, so you'll notice it's a capital A in ABC123. I'll show this slide again, but you go to that website, you can find all the information and more that I'm going to try to cover today. So let's jump into the benefits. We have 3 plan design options with Cigna. In addition to that, we've got the MEC plan, the Minimal Essential Plan, that's going to continue with MagnaCare. I'll begin with the Cigna plans. Now, you see here at the top, it says good, better, best. Perhaps that's bad jargon because there really is no best plan. There's the best plan for that particular person. But in the abstract, there is no best plan. You have the ability here to choose what plan is best for you. But we're calling it best and better based on the generosity in the plan design itself. Now, to go over this quickly, these first 2 plans here, best and better, these first 2 plans here are identical network benefits, what have you, coverage, what have you, except for the deductible. The deductible for certain services, not all, we'll elaborate on that. The deductible on the best plan is $500 for a single, $1,000 for an employee with 1 or more dependents. And then on the second plan, what we're calling the better plan, the deductible is $2,000 per person, $4,000 per employee with dependents. For those of you who are on MagnaCare, you'll recognize what's being called the better plan as what's currently in place with MagnaCare. We duplicated that benefit, but we wanted to give everyone the ability to buy up if they so choose, and an HSA option, which I'll go into in more detail as well. Important to note, those of you who have satisfied all or a portion of your deductible already this year, the deductible runs on a calendar year, which means that it starts January 1st. For those of you who have satisfied all or a portion of your deductible, Cigna will allow deductible credit. For those enrolled in MagnaCare right now, I can get a deductible credit report that shows where you are in relation to satisfying your deductible, and I can share that with Cigna electronically. For everyone else, what you would do is take your most recent explanation of benefits, your EOB. That's the report that the carrier sends to you to tell you all about that last doctor office visit you had. Those reports have a running tally of where you stand in relation to your deductible. So take your most recent explanation of benefits, EOB, and submit that to Cigna so that you can get your deductible credit. So you have deductibles on both plans, and then after the deductible has been met, it goes into coinsurance. 30% is what you would pay after the deductible has been met. 70% is what the insurance company will pay. Out-of-pocket maximum, that's exactly what it sounds like. It's the maximum out-of-pocket you would have to spend for your in-network services. This was new with healthcare reform across the nation. Some states already had this protection, but across the nation, this was new with healthcare reform. $6,250 is the single out-of-pocket maximum. $12,500 is the out-of-pocket maximum for an employee with one or more dependents. Now, as I said, those deductibles are not applied to everything. If you go to your primary care physician, your family practitioner, your OBGYN, if he or she's listed as your primary care physician, you'll pay a $30 copay. That is not subject to deductible. You'll pay a $30 copay for that visit. If you go to a specialist, now these plans do not require a referral. You can see a specialist directly, but if you go to a specialist, you would pay $50 copay for that specialist office visit. Now, why the difference? The difference is, if I have an ear infection, I can go to an ear, nose, and throat doctor, and they'll prescribe me an antibiotic for 10 days, and I'll be fine. I can get that same prescription from my primary, and the primary care physician costs less than a specialist. So since the insurance company saves money, they want to pass that savings on to you. So take advantage of that. Cigna Telehealth Connection Services, we'll talk about that more later, but you have that ability on these plans as well. Diagnostic lab, diagnostic x-ray, these are services that are deductible and then co-insurance. Now, this doesn't apply to your preventative care benefits, but if you do need another diagnostic lab or x-ray, you would first pay the deductible and then co-insurance up until your out-of-pocket maximum. Inpatient, outpatient hospital service. Inpatient is if you are actually admitted into the hospital for an overnight. Outpatient, you go to the doctors, you go to the hospital, you have the procedure, and then they release you the same day. Both of those are deductible and then 30% co-insurance after the deductible. The plans are identical as well when it comes to emergency care. Hospital emergency room is a $100 copay on both plans. Urgent care facility, $75 copay. The prescription plan. Both plans here have a 3-tier prescription benefit, $10, $35, and $60. $10 is generic. I think we all know what that is. $35 is brand name on the formulary. $60 is brand name non-formulary. Essentially, the difference is this. If there are 3 drugs that supposedly all do the same thing, the insurance company is going to put on their formulary list the drug that offers them the biggest discount. Since they're saving money, they can pass on that savings to you. So if you take the drug that is on their formulary list, their preferred list, you would pay $35 for that drug, that brand name drug. If you want to take the other drug that's not on the formulary, you have the ability to do that. You would simply pay a higher copay for that, $60. These plans, none of these plans actually, have any out-of-network benefits, and that's by design. I find that having out-of-network benefits isn't really the value that you think it is, because the doctors outside of the network have no contractual obligation to honor the discounts that the insurance company pays. What I find is a better way to go is to get a strong national network that everyone can find a provider with. Now, as I said, your carrier here, your network, is Cigna. I'm sure you're all familiar with the name. It's one of the top insurance companies in the country. We did some reports and some studies, and we didn't see any reason why anyone can't find a doctor within the Cigna network. So we're with Cigna moving forward. Now, the cost per bi-weekly paycheck, so 26 paychecks in a week, 26 paychecks in a year, the cost per bi-weekly paycheck on this best plan, $201. On the plan with the higher deductible, $177. Employee and spouse, $485 for the plan with the $500 deductible, $1,000. On the better plan with the higher deductible, $435. Now, I don't need to go into these rates directly. You can see the rest of them here. The important thing to note is that, for example, you all have auto insurance. And as you increase your deductible, you lower your premium. That's what we're doing here. And as you can see, as we increase the deductible from $500 for a single, $1,000 for an employee with one or more dependents, we increase it to $2,000, $4,000, the premium that you're asked to contribute goes down. Now, the HSA, I want to spend a little bit more time on that. The HSA is listed as a good plan. HSA stands for Health Savings Account. Now, don't let that big deductible scare you away out of the gate. $5,000 for a single, $10,000 for an employee with one or more dependents. I personally, with my wife and our 2 daughters, are on an HSA, and we have been since 2007. You probably heard about this, talked about a lot in the news. With an HSA, we increase the deductibles, just like the auto insurance analogy I gave you. That drastically brings down our premium. So for a single person, they would pay $80 per paycheck. An employee and spouse, $230. Compare that to the cost on the other 2 plans, and you see the savings there. But it creates a hole, because now you have this large deductible which applies to everything except for your preventative care. Those of you who enroll in an HSA, like myself, are allowed to put those premium savings and additional money, if you like, into a health savings account. You would do this on a pre-tax basis. So if you put $100 in, it'll feel like $75 out of your cash flow, because you have the pre-tax benefit there. Please do not confuse this with a flexible spending account. With an HSA, a health savings account, the money is yours. Whatever money is left in the account at the end of the year rolls into the next year, so on and so forth. Like I said, I've been on this plan since 2007, and I've been able to save some money. I haven't been able to afford maxing out my contribution, but I've been able to save some money, so that when my wife and I welcomed our daughters into the world, we had money saved up to cover those expenses. Last year, when I dislocated my elbow, I had money in my HSA to cover my expenses. So I was able to save money in the good years, the years that we didn't have anything going on. And then in the years that we did have things going on, I had money built up to cover those expenses. I really like this policy, not just because I'm on it myself, but because the money that you put into the HSA, it saves you money on premium, and then you can use that money as you deem fit. So you can use it to satisfy your medical expenses. You can also use it for expenses that are outside of your medical, like dental, vision, acupuncture, if you're so inclined. I could go into it more, but I did put some information about the HSA on your benefit website, so access that when you can. Now, the last plan design here is the Minimal Essential Coverage Plan, the MEC plan. It is exactly what it sounds like as well, minimal essential coverage. Despite what President Trump and Paul Ryan are trying to do in Washington, Obamacare, healthcare reform is still the law of the land. And part of that law is the individual mandate, which means that everyone is expected to have insurance or pay a penalty. As a favor to all of the employees, what we did here for Express Stores was offer a minimal essential plan that satisfies the individual mandate. It doesn't offer a whole lot of coverage, but it only costs $15 per paycheck. Let's talk about the individual mandate a little bit more. So as I said, the government's going to charge you a penalty if you don't have insurance. In 2016, that penalty was 2.5% of your household income, or $695 per person, whichever one is greater. This plan is going to cost $15 per paycheck. That's $390 a year. I would love it if anyone could call me up and explain to me why paying the penalty and getting nothing in return is a better option than signing up for this minimal essential coverage plan. If you do nothing else, most of you will sign up for the Cigna plan. But if you're thinking about not having insurance at all, you're going to pay this penalty. You may not have noticed that you paid the penalty for 2016 because it was simply deducted out of your refund. This penalty is the law of the land, the individual mandate. This is a fantastic tool to avoid that penalty. You really should explore it if you're debating about not having insurance at all. Health insurance marketplace, I can't go into detail. This presentation will also be on the benefit website. Long story short, Express Stores coverage is deemed affordable, minimal essential coverage, and minimum value. It satisfies all of the tests that the government asks an employer to satisfy. Cigna. Now, these slides, again, are on the benefit website. Please register for the website. You can, those of you who enroll in Cigna, you can manage and track your claims, view ID cards, print new ones if you happen to lose your ID card, find doctors, so on and so forth. There's a lot of tools on Cigna's website, which I can't go into detail, so please log on. Finding a doctor. You are all scattered across the country, so this is on your benefit website, mybenefitscount.com. It's instructions on how to find a Cigna doctor in your area. Please take advantage of this. MagnaCare, those of you who decide to enroll in the minimal essential coverage plan with MagnaCare, of course, can also access MagnaCare's website to find a doctor and see claims and what have you. So please take advantage of it. Cigna prescription home delivery. Any of you who are on chronic medication can do mail order. You probably already are, and you know that it saves you money. So please look into that. This I'm going to spend a few extra seconds on. The Cigna telehealth, and MagnaCare also has telehealth as well. This is a fantastic service. What it allows you to do is call a doctor. You can do it from your desk at 3 o'clock in the afternoon. You can do it from your home at 3 o'clock in the morning, whatever the case may be. You can call a doctor. You can even Skype with a doctor if they need to see a video, a rash. You can take a picture, so on and so forth. The doctors, through this service, can see you right away, and then they can prescribe medication if need be. If they need to refer you to a doctor during normal business hours, they can do that. But this really does help you a lot. You may simply not want to sit in a doctor's office waiting room, may just not have the time, or like I said, it might be 3 o'clock in the morning and your only option is a expensive emergency room visit. This is a fantastic tool. Please sign up for this, whether you enroll with MagnaCare or Cigna, and please do it right away, because 3 o'clock in the morning is not the, 3 o'clock in the morning when your kid's sick, that's not the time for you to go online and sign up for this service. So please sign up for this right away. How do I enroll in or waive the insurance offered by Express Stores? I am told that you are all familiar with Balance Point. That is your vehicle to make your coverage election. Again, July 26, 2017. Please don't wait. We want to get the ID cards in everyone's hands as soon as possible. For those of you who are new, the waiting period, you are eligible to sign up for the insurance the first of the month following 60 days of eligibility. Qualifying events. This is important. So right now, this is your opportunity to enroll in the insurance. If you choose not to enroll in the insurance now, you cannot enroll in the insurance until next year's renewal, next year's open enrollment for August 1st, 2018. So please sign up now. It's the time to do it. The only ability that you would have to sign up later or to add a spouse later, whatever the case may be, is if you have a qualifying event. That is a life change. So you decide to waive the insurance that Express Stores offers because you're enrolled on your spouse's insurance. And then, unfortunately, your spouse loses his or her job, loses the insurance. That's a qualifying event. You could then come on. But if you're waiving the coverage and you do not have coverage elsewhere, then you will not be able to enroll again until next year. So please take advantage of this opportunity. The website, again, that you can find all of this information here and more, mybenefitscount.com, username, mybenefits@expressstores.com, password, case sensitive, ABC123. 3. And just to give you a little taste of what that benefit website will look like, this is your benefit website. So even in 2017, we all know how to work file cabinet, and that's how we set it up here. So you have the MEC plan, the minimal essential coverage plan, the Cigna plan, and then your human resource tab, your HR tab. You'll notice that if you have any questions for me or either of my assistants, our information is found at the top here. Beth Ann Donald, Maria Gerkins, our email addresses, our phone numbers, you can find that at the top. You also have your HR number down below. I added a lot to the website. For the Cigna tab here, you'll see the 3 plans next to each other so that you can compare and contrast what each covers. Now, I can only put so much information on, so if you need additional information, just click on the sides here. Open Access Plus Plan 500, 1000, summary. That's the much more elaborated plan design. So if you have additional questions and you can't find the answers here, you can do that. I also put some additional items on it, health savings accounts, information, preventative care. Some of you may be asking, what is preventative care? So I put those links on it as well. I also put this presentation. Oh, and right here is a presentation all about health savings accounts. So take a look at that if you have more questions. HR tab, you'll see here that you have a qualifying event checklist, qualified life event infographic, healthcare reform. What does the individual mandate mean to me? If you want more information about that. Express management PowerPoint for Cigna. This is the PowerPoint presentation that you're actually watching right now. The handout for the rates, if you want to see the rates again, you'll find those here, so you can open up that. And then there's some additional information here because you're going to have questions. So HSA, eligible expenses, what can I use that money for? What are the limits if I want to save more in my HSA than just the deductible? HSA limits for 2017. An emergency room visit versus a doctor office visit. What is it going to cost me? Preventative care. What is preventative care? What's covered underneath it? You'll see that here. So preventative care, you have adult preventative care, blood pressure screening, colorectal cancer screening, so on and so forth. Down below, preventative care for women specifically, and preventative care for children. So if you have questions about what is covered under your preventative care benefit, you can find it here. I'm sorry, I'll drag that screen over. This is what I was referring to. So preventative care for adults, for women, preventative care for children. That is more time than I was probably even allowed. Again, the benefit website, www.mybenefitscount.com, username and password. Thank you very much, everyone, for taking the time to listen to this. I hope I did a decent job in the limited time. Please let my office know if you have any questions. Have a great day.